Welcome to the Movewell Academy and our Palpation Series. Let's look at the bony landmarks, ligaments, and tendons on the lateral foot and ankle. The easiest place to start is the most obvious bony landmark, the lateral malleolus, which is made up of the distal fibula. If you find the lateral malleolus and then fall all the way down to the lateral board of the foot, you are now sitting on the calcaneus or the heel bone. If you move distally towards the toes, the first bump you feel on the lateral board of the foot is a prominent tuberosity of the fifth metatarsal. This is the point of attachment of peroneus brevis. Peroneus brevis is one of two major ankle everters and the muscles that are responsible for decelerating or preventing the dreaded ankle sprain. So if somebody sprains their ankle and they have injured their peroneus brevis, the most common point of tenderness is at the tuberosity of the fifth metatarsal or just proximal to it where the tendon is. Sometimes the force can be so great that you sustain an avulsion fracture of the fifth tuberosity of the fifth metatarsal. As you trace that fifth metatarsal down, you will run into the fifth MTP joint, metatarsal phalangeal joint, and then the next joint is a PIP joint and then a DIP joint. Okay, so those are the bony landmarks on the lateral aspect of the foot. Oh, I missed one. When you find the base of the fifth metatarsal and then you fall off of it, if you squeeze that bone there, you are now on a major tarsal bone called the cuboid. The cuboid can be a problematic bone in people who are over-supinators. Cuboid syndrome is a subluxation or a loosening of the ligaments that secure this bone, a hypermobility of that bone, and so it's important to be able to palpate the cuboid. Again, find the tuberosity of the fifth metatarsal, fall off of it in the proximal direction, and then squeeze the bone between your thumb and index finger. You will have the cuboid bone in your hands. Let's talk about ligaments. Lateral ankle sprain is the most common ankle sprain and one of the most common lower extremity injuries you will encounter. Three major ligaments can be at risk in a lateral ankle sprain. All these ligaments check inversion. The most common one that is injured is the anterior talofibular ligament. If you take your finger from the lateral malleolus and move anterior inferior, your finger will fall into a divot. This divot is called the sinus tarsi, and just distal to that is the point of attachment of the anterior talofibular ligament. Notice how close I am to the fibula. So if you have any space between your finger and the distal fibula, you are not on these ligaments. So anterior talofibular ligament, which checks plantar flexion and inversion. Calcaneofibular ligament, which checks inversion in neutral, and then posterior talofibular ligament, which checks inversion in dorsiflexion. So let's see how we can stress those ligaments. Palpating them is easy as you make your way around the roundness of the distal fibula. Here's how we stress test them. Plantar flexion inversion tests the anterior talofibular ligament. Notice my hands on top with a cylindrical grip, and I'm plantar flexing and inverting, and there's not much space between my hands. What you don't want to do is put multiple joints between your hands when you're testing the ankle. So make sure they are close. Anterior talofibular ligament, plantar flexion, inversion. Go into neutral. Inversion in neutral, test the calcaneofibular ligament right off the distal end of the fibula. And then dorsiflexion and inversion, test the posterior talofibular ligament off the backside of the distal fibula. 3 lateral ankle ligaments that are important to palpate and test. And then finally, we're going to get to the tendons on the lateral side of the ankle. The first one is going to be peroneus longus, and deep to it is the peroneus brevis. If you like this video, please share it, and don't forget to subscribe to our YouTube channel. Also, subscribe to our blog at movewellacademy.com, where we constantly upload and update information about pain-free living. Thanks, and we'll see you next time. Peroneus longus tendon is the one that is most intimate and easily felt right posterior to the lateral malleolus. Beneath that is the tendon of the peroneus brevis, but the peroneus brevis tendon and where it's usually involved can be palpated more here on the lateral foot. So peroneus longus. They both perform eversion of the ankle. So to test them, you want to resist ankle eversion. So evert the foot, don't let me push. And as the person pushes their foot out, you are pulling in, okay? How do you know when you do that test which one of these tendons is involved? It's usually in the palpation. Again, peroneus longus will have tenderness here, and at the base of the first metatarsal and navicular. Peroneus brevis will have palpation pain here, usually closer to the tuberosity of the fifth metatarsal. And that's the main bony, ligamentous, and tendons of the lateral foot and ankle.